Hi, everyone. I am Amanda Foster, the Director of Programs at Human Animal Support Services. Unfortunately, Kaycey is not going to make it today, but she has been working with Haas on this project for well over a year now. She's the Administrative Manager of Pet Support Services at Greenville Animal Care, and she runs an amazing program that we're going to talk a little bit about today, and her information will be at the end of this presentation as well. She's always open to questions if you have anything specific for her and you want to hear a little bit more about somebody who's running a great pet support services, human-centric program on the ground. So with that, I will move right into our presentation. So we're going to be talking today about our intake triage project that the Human Animal Support Services team has been working on for quite a few years now. And this project really started because when we all came together at the beginning of the pandemic and we're rethinking animal services, we were trying to figure out why are pets entering animal shelters and to take that moment in time to step back and say, why are pets coming to the shelter? Because we have this change in our world and a chance to actually question how we're doing things. Why are pets entering animal shelters and what can we do about it? And so that's really where the background of this project started. And so as a part of that, some people came together and said, all right, let's look at the reasons for intake. It's because that makes the most sense as when we're looking at our software and the data that we put in to our software, and we want to look at it at this high level. Why are pets entering animal shelters across 13 organizations? And what we found was that the data that we had to lead that discussion was just not helpful. So as you can see there, the most common reason that we were seeing was general or null, which really wasn't helpful to look at from a high level to be able to say, okay, how do we build programs or support our community in keeping their pets around owner surrender? If we're looking at an intake reason as of general, they're just not a good, what do we do with that? How do we step back and say, let's build something around general? We can't. So that really led us to take a deeper look at intake reasons. When you're looking at this word cloud, you might also notice that some of these are really focused around the pet. So things like behavior issues pop out, things like aggression from the resident pet, these, and then other things are less useful or might be specific to an organization's processes, like Return 30, COVID home, stuff like that. So when we were looking at the data from kind of a high level, there just really wasn't a good way for us to say, okay, this is what we should be doing to help people to be able to keep their pets. And so really what that meant is that our traditional intake model that we'd been working on for years was just the tip of the iceberg, and we were missing all these complex human circumstances below the surface. And the complex human circumstances are where we can really work with our community in keeping people and pets together. And when we're talking about keeping people and pets together, I like this graphic because it kind of shows the cycle of somebody who that might fit a lot of circumstances around people that are surrendering their pets. So they have a crisis, or they're moving, or something happens where in their life that has changed their ability to keep their pet. They might look for resources in the community, into their plans when supporting humans. So that's an important piece to call out here. And then ultimately, when we're talking about owner surrender, we're ending with community members bringing their pets to the animal shelter. And when we zoom out to the animal shelter, And that's important context for like the development of this project here. So some of examples of those interruptions that may exist in a community or may not yet exist in your community are things like financial assistance, um, legal aid, housing assistance, temporary sheltering, human and health services working together for pet owners, etc. So that's what brought us to form the intake triage project. We use the word triage here, which is an important part of this project. So thinking about our traditional intake model as being more of a transactional, somebody needs to give up their pet, we take their pet, and moving into more of a
It looks like Amanda's freezing a little bit, so I
no,
apologize, everyone.
uh-oh, am I back?
Just, you're back.
Okay. Where did I lose you?
I think we're at develop a framework.
Oh, okay. So moving into the what developed as the intake triage project, we focus on the word triage here because we really wanted to move from a traditional transactional approach to intake where somebody is in need and needs to give up their pet for one reason or another, and we take that pet into more of a triage model. And when I say triage, I mean a process that more closely mirrors human services. So when you go to the doctor or to the hospital, you might go through a triaging process where somebody is learning more about your circumstances and how they can support you um, to determine the best path forward. And so that's what we mean by triage here. And then part of our goals was to develop a framework to understand the complex circumstances that bring animals into the shelter. So, like we saw with the word cloud a couple of slides ago, really we can't do much with that. So, developing a framework to get better data so that we can make strategic decisions at a high level for our communities. And then using that information to identify where to focus programs and resources so that we can help keep pets and people together. So some of the benefits and reasons why we should be collecting better owner surrender data. So in addition to like what we saw with that word cloud, we also need that information so that we can really understand the situations that are creating separation between pets and people on that individual pet and human level to support people in front of us, but also at being able to zoom out like we were trying to do back in 2020 to be able to say, okay, where is the most need in our community that is resulting in pet intake, and how can we build solutions and work with our community to help them keep pets if that is their goal. Okay, so we're going to take a moment and talk through a scenario here and ask you all to weigh in. So we took this directly from Lexis Lee, who's a PhD student, and she did this great study around intake reasons and intake staff collecting information about people bringing pets in. And she used this example in her study, and we loved it. So we're going to use it here today. So Elke, you get to be uh, in this workshop with us. So you can be the owner, and I'll be the staff member. And we're going to walk through this together, this scenario that is pretty common in intake lobbies. And then we're going to ask the audience to weigh in. All right,
Okay.
go ahead.
Hi there. I'm here to surrender my dog.
Okay, could you tell us why you were giving him up?
Well, for one, he's super hyper. Every time my girlfriend or I get home, he jumps all over us. Also, my girlfriend is pregnant, and I don't know if having a dog is the best for our growing family.
Oh no, I'm sorry. If you would like, we have a dog training program where you can get some assistance.
Oh, no, thank you. I just want to give him up to you regardless. When I approach him while he's eating, he snarls at me, he snaps at me, which is obviously a big problem. Taking care of him and the baby will just be too much. I won't be able to pay as much attention to him as I do now, anyways.
I understand that. Okay, so now for anyone who is in the audience, I would love to know what you think the reason is that Elkie is giving up her dog today. So if you could scan this QR code and join our Slido, we're going to create a word cloud based on what you think the primary reason is. So you can only select one, just like you would in most shelter software. I'll give you a minute to do that.
Mary Lou says maybe it's the girlfriend. I'm glad we're doing this because I'm doing this at a presentation too. Did you do this in Carolina?
We did,
Did it
yeah.
work well?
And we also did
Yeah.
it on site for this project. Um, Jen does a great job doing an exercise with staff around this. Looks like we have a few people still typing. Remember, you're entering this like you
That's
would.
okay, Mary Lou. I appreciate your answer. Mary Lou says too old. Doesn't understand QR codes.
That's okay. That's all right. You can throw it
Mhm.
in the chat. Okay. And we have a few people still typing, but that's okay. It'll add to our word cloud still. And I'm going to go see what we said. All right, so this is interesting. So we have behavior showing up the most, resource guarding, training, new baby, the person is overwhelmed, not enough time for training, baby, unwanted. Okay, great. Got a couple people still typing. So what's really interesting about this is that even with just our group here, we have a wide range of different answers that show up, which is a great example of how complicated these circumstances are. So I'm going to move on to the next slide here. So some of the things that you all pulled out are things that are really common. So behavior, the pet is too active, there's a life change, new baby, the behavior of growling. I know a lot of people said resource guarding, and then no time slash too much responsibility. So answers like unwanted and things like that. So what's really interesting here is that we are getting a lot of different answers and that they're all influenced by our own personal bias, right? So when so my background, for example, I was once in a behavior department. So I'm inclined to think, okay, a pet is coming in. What is the next thing I'm going to have to do to be able to move this pet through? So I might be inclined to lean more towards the behavior aspects of this conversation, whereas somebody else might be more inclined to focus on the human aspects in here, like the new baby or no time. All of us are right. And but we need a way to be able to look at this so that we can help circumstances like this at a larger level. So this is just important. It's a good exercise to think about when you think about your own biases that go into how you're selecting those intake reasons and the impact that that has on the data that
And
comes out of
you
it.
know what, Amanda, don't kill me. So this was like I'm flashbacking to 25 years ago when I was pregnant and I had a very hyper boxer. But fortunately, I knew about the local shelter who had a training class. So this also like so not only so we might not be able to stop this situation from happening, but it could be a thought right at that shelter like, oh, maybe there's some more communication we can do around preparing individuals who are planning on getting pregnant or are pregnant and have dogs. That might be a little much. And kind of like thinking the proactive approach, right? So there might
Right.
be some things here maybe that you could offer, but this person might be, nope, I don't need any resources. This is my decision. But then taking and learning from that there might be opportunities.
Absolutely. And I'm actually glad that you said that because that's really the framework of this project that we're about to talk about, right? Is moving away from just taking a pet in to really having that conversation, not just so that we can help the pet in front of us and see where we might be able to intervene, but where can we help pets that are coming into our shelter? How can we help pets and the people that love them, and helping them to keep them sooner? So I think that's a great example. All right, so enter our intake triage project. So this was a very large project, and we have decided for this webinar to break it into two portions. So today I'm going to focus just on the owner surrender piece that we're talking about, but we also did an entire section on lost pets and what people in the community are doing when they find lost pets. So in April, we'll be having a second part to this webinar to talk about all of that. But today we're going to focus just on what can owner surrenders tell us about unmet need in our community and really capturing the why behind the decision to seek surrender, with the ultimate goal, of course, to inform how we support people in our community. So a very big part of this project early on was addressing that word cloud that I shared at the beginning of this session in creating a more standardized intake reasons list. So this list took quite some time. It took us a few years. We worked with a lot of national orgs, pilot shelters, Shelter Animals Count did some focus groups for us. So there's a lot of expertise behind the development of this list. With that being said, I always consider intake reasons to be a work in progress. We'll probably never get exactly to perfect, but if you're looking for a place to start, to get more standardized intake reasons, this list is a great place to start, and I'll share a link to where you can download it at the end of this call. But it was built in collaboration with a lot of industry leaders, and the if you're thinking about how to use this or like how this works in your software, every software is different. Most softwares, of course, require just one intake reason or a subtype, no intake reason. And we do have workarounds for that. I know Animals First is also working on the ability to multi-select, which is the ideal situation because, as we all saw a little bit ago, human circumstances are complex and there might not be just one main reason that goes into a surrender. Okay, so the shelters that we did this project with were Lifeline Animal Project, Greenville County Animal Care, where Kaycey Adair is from, and Guilford County Animal Services. So they were in one specific part of the country, but they varied in size, and intake type, and we got a lot of great information from them and are hoping to continue to broaden the scope of this project. So the elements of this project, we decided to collect data and information from 3 points in time, um, using a intake form that allowed for multi-select, meaning that you didn't have to choose just one primary reason, but could select all of the contributing factors to an owner surrender intake. And we did end up building that data collection outside of software just because most softwares don't allow for that type of flow currently, but we are hoping that that changes in the future. So for this presentation today, we're going to focus just on these two. So first point of contact, think about this as when somebody first reaches out to your shelter, either online or they call you, they show up for the first time. This is the first time they interact for searching for resources or talking about potentially surrendering their pet. And then we also collected information at the point of intake. And during this point in time, we did a conversational interviewing approach. So staff would use the form to guide their conversation and collect information along the way with the person who was surrendering the pet. And I will note that all of these, or most of these pictures that you'll see, are from the on-site implementation at these shelters. So let's start with first point of contact, which is when somebody first starts to contact you about potentially giving up their pet. At the first point of contact, we found that the reasons that owners were reaching out for support with keeping their pet fell into these five, were ranked in these top five categories. So, routine wellness, unable to fulfill the pet's mental or emotional needs that were not related to finances. So, that might be your no time or overwhelm. Pet food resources, they were looking for support in pet fees, pet rent, or ongoing fees related to their housing or the owner's health. What's really interesting about this is these are often, a lot of the times, things that we're also talking to our community about proactively, but they don't necessarily cover all of the need. And while we looked at that in aggregate, it is very important to remember that these results vary by community. So I'm going to break this out. So at one shelter, what was impacting the most people was this owner or household preferences around the pet. But the most frequently chosen reason was that they couldn't afford ongoing pet rent, fees, routine wellness, and the most common pairing when they could select multiple was owner health and routine wellness of the pet. For another shelter, we saw that that caregiver has no time or they're overwhelmed was the number one category, and the most frequent reason was unable to fulfill the pet's mental or emotional needs. The most common pairing was routine wellness and unable to fulfill the pet's mental or emotional needs. And at the last shelter, we saw finances as the biggest barrier. And then within that, cannot afford routine wellness was the top reason. And the most common pairing was cannot afford pet fees, pet rent, or ongoing fees related to housing, plus routine wellness of the pet. So I think it's important to look at it both ways. And of course, collecting this information for your own community is really important because your community has unique needs. So at the point of intake, so this is after we've already talked to them, now they're here for their surrender appointment or coming in, walking in to surrender their pet. So at this point in time, the owner arrives at the shelter, they're ready to surrender, and they're having that interview with the staff to really have that triaging experience and really get to that root cause of the human circumstances that are related to the pet coming in. And again, the purpose of that is not only to help the person in front of us if we do still see an opportunity to support them with resources, but also to get this information in a way that we can zoom out later and look at our programs and our community and say, where's the biggest need? What can we do? So at the point of intake, um, the ranking was different. So now we're seeing things like pet to pet safety concerns, pet to people safety concerns, nuisance behavior. And nuisance behavior in our context means normal pet behavior that is seen as not a, that the person is seeing as not a good fit. So it might be things like scratching on furniture, barking, being too energetic, things like that. And then unable to fulfill the pet's mental emotional needs and took ownership without intent to keep. And again, the results vary by community. So at our first shelter, we're seeing that behavior per owner impacted most people, and that pet to pet safety concerns was the most chosen reason at intake. The most common pairing was the pet's energy level and unable to fulfill the pet's mental and emotional needs. And a shelter C, one of the shelters wasn't able to collect the at point of intake information, so we just have two here. And at shelter C, we had housing as what was impacting the most people, and then those nuisance behaviors as the most frequent chosen reason. And then cannot afford routine wellness plus unwanted litters was the most common pairing. So now let's look at what we consider to be the support gap. So we have all these people that are reaching out for support, at that first point of contact. And then we have those pets that are actually coming in as an intake and what that support gap is. So shelter A was seeing most people are reaching out for support around cannot afford ongoing pet rent, fees, uh, can't afford routine wellness. And then at the point of intake, we were seeing pet to pet safety concerns. So that gap might exist because perhaps shelter A is able to support a lot of those other reasons, and what is resulting in intake is pet to pet safety concerns, or it could be that people had found other solutions. It's hard to say for sure. Oh, okay. I've lost shelter B there, but we'll share it out on the slides. Okay, so um this is where Kaycey Adair would come in. She's not here today, so I'm going to do my best. But Kaycey Adair runs a great program at Greenville County Animal Care and Control. And this was actually taken in her lobby, this picture of this cute dog here. And we're going to talk a little bit about her program, and I will do my best to answer questions, but if there's anything I can't answer, we will provide her contact info at the end of this. So Greenville ran this data collection with us for over a year. At the first point of contact, this is kind of like what their system looked like. They would have owners fill out a survey online. Caseworkers or intake staff would review that information and follow up to offer resources so that they could keep the pet if able. And if the resources were not going to be helpful, they would then schedule an intake appointment. And then at intake, staff would use the form to guide a conversation. So I believe that they had tablets where they had the form that they could just kind of use to guide and fill out as they were having that conversation. And we did a lot of training around ensuring that the clients would feel heard and supported. And Kaycey's team did an awesome job. They have this one-on-one private space that they created for this program so that they could have conversations with people in a private environment. I know that that's not possible everywhere, but definitely a great bonus so that people can feel comfortable when having these sensitive conversations. Staff would address any concerns with empathy. They would offer alternatives to surrender if applicable, just as one last chance to like try to intervene if that was a possibility. And then if of course intake was the best option, that would be the next step. So some of the things that we found was that only 1% of those that were intending to surrender were actually keeping their pet at the point of intake in Greenville. So that means that by the time they got to intake and they were in that room having conversations with shelter staff, only 1% of the time were staff able to offer some kind of support that led to the people actually keeping their pet. And here are some of the resources and support that Greenville was offering to people. They also have this really cute little store here in this picture. We also found that pet owners were seeking surrender due to financial constraints, housing, and veterinary care most often. Cannot afford was the top reason chosen more than a third of the time, with respondents often citing multiple financial struggles, meaning if finances were an issue in one area, it was often an issue in multiple areas. So it might not just be housing or pet food or medical or behavioral. It could have been a combination of all of them. Their most common concerns were things like pet rent, routine wellness for their pet, and non-emergency medical treatment. Financial strain, again, is a major factor in pet surrenders for them. They also found that pet owners seek surrender due to housing. This was really, really interesting. When we originally started working with Greenville on this project, there was a thought amongst some of the staff that housing was going to be the number one reason why pets were coming into Greenville. And what we found is that it was actually the second most common reason, which was a surprise to them. So it was really a good opportunity to use data to really show where the need was and not just what our interpretation of the need was. So at intake, 13% cited housing that was mainly around pet number restrictions. And the shelter supports pet rent challenges, but has opportunities with owners facing pet number restrictions. So this is really interesting. We had all gone into this thinking housing was going to be the number one thing. And while Kaycey's staff spends a lot of time talking about housing as a barrier to keeping people their pets when people are reaching out at that first point of contact, they're actually likely deferring a lot of those with the resources that they've gotten in their community. And what's actually resulting in intake is not housing as frequently as they thought.
Amanda, quick question. What was, if you know this, what was the turnaround time? And I imagine it may be fluctuated from the time the owner filled out the survey to the time they were contacted by an intake coordinator or case manager.
Unfortunately, I don't know the answer to that. That would be a
We'll
great
find
question,
that out.
Lucy.
Okay.
Yeah. Okay, so next steps. So some of the things that Greenville is focused on next. Um, and these are some of the findings that they're hoping to build off of and prioritize. So only 1% of those intending to surrender kept their pet, so they're wanting to reach people sooner. Um, because by the time that people are getting to the shelter to have those conversations, it's too late for them to be able to offer support that helps people keep their pet if that's what the owner is wanting. Um, there's a need to know what people are struggling with prior to getting to the shelter. And then assemble more resources to help community members sooner. So all of this really focuses around Greenville taking this information from this project that they're getting in, and they're continuing to collect data and look at it. But they're really going to be focusing next on trying to reach people in their community sooner.
I mean, I imagine this is probably a Kaycey question as well. Did you talk to her about what the resources are that were offered for housing issues that may have resulted in the owners keeping their pet?
Yes. So I know that they do a lot with supporting with pet fees, and that Kaycey also keeps an up-to-date list on places in her community that allow pets and what they do allow. And her team works with those people during that first point of contact and at the point of intake whenever they're having those conversations to give those resources and to have those conversations. But Kaycey has done a lot of great work around understanding how what her community is able to offer pet owners as far as housing goes. And we'll share her information at the end of this if you want to ask. Ask her for information. I know she's happy to share it.
Thank you.
Okay, so now we're going to jump into, that was a great case study, and now we're going to jump into kind of what the findings were across the board and how that information might be able to be actionable in different communities. But first, and I would love to, if you all could, I don't have a great Slido for this, but I do want to know what you think owners are trying before they contact the shelter. So this is new. We didn't share this at Carolinas Unite. So if you have a guess about what owners are doing before they ever reach out to us as shelters, go ahead and put that in the chat. And Elkie, I can't see the chat, so if you could just
Will do.
call them out for me.
Rehoming,
Okay. What else?
rehoming to friends, family, posting on Nextdoor, Facebook, asking questions at their local pet store, friends and family to help with care, place on social media, asking family, posting on Facebook. Social media, behavior consults, local pet pantry.
All right, awesome. I'll stop you
Asking
there.
their vets.
Okay, great. So all of those are great answers. The number one thing that people are doing before they ever reach out to a shelter is nothing.
There were some nothings in there as well. I was
Okay,
trying to keep
okay. The number one thing people are trying is nothing. They are coming to us first, which is, it might be shocking, it might not be shocking, depending on your experience, but um, that screams opportunity to me. That should not be our number one thing at this point. So that just screams opportunity. We need to get the word out. But other things that people are doing are rehoming with friends and families. I think that we heard that one in the chat.
Yep.
Talking to neighbors, posting online, accessing resources like pet food, supplies, training, medical support, trying to find pet-friendly housing. They've tried surrendering to other places, or they might have returned to the previous owner. But by and large, they're not trying anything. We're still the number one place to go, which not that there's anything wrong with that, but if we have resources to offer, but it definitely shows that there's still opportunity to reach people with what they can do before they come to us.
I think number 5 is interesting.
Yeah, and that was a very
Mhm.
low
Yeah,
number,
but
but yeah,
interesting.
it is interesting. Okay, so some of the top findings that we saw and what we can do about them. So financial strain is impacting pet retention. Right, people are struggling right now. I think we all are seeing that in our intake lobbies. We're seeing that just out in the world right now, that financial barriers to being able to keep our pet um, is a big problem right now. And it's also something that we can work on. There's options out there like partnering with human service agencies to reduce financial burden on pets overall. If we only have so much money and we have to spend it on our rent and our transportation and our own health and our families, anywhere that we can chip away at that financial burden on pet owners and on people in our communities, it makes it so that we're more likely able to keep our pet if finances are in the way of that. Another big takeaway was that basic behavior support is still needed. A lot of the behavior related inquiries when people were first reaching out to shelters were not due to human or animal safety concerns at all. So when we think about behavior, a lot of times we tend to think of these really emergency situations that are urgent, like pet or people safety issues. But most of the time when they're first reaching out for support, it's falling into that nuisance category. So things like barking, pulling on leash, too high energy, things like that. So there's still a big opportunity and need for support around basic behavior needs of pets in our communities, that could make a big difference on our shelters. And gathering more context, which of course we talked about early on, being able to not look at just general as an intake reason, but being able to see, okay, like here are the common circumstances and contributing factors to owners surrendering pets in our community gives us a fuller understanding of what the need is in our community and how we can support them. And then my favorite, spread the word. We are seeing all across this presentation that people need to know what to do sooner. We saw that 85% of people say it's too late to help with resources, indicating that they needed support sooner. So in Greenville, there was only 1% that they were able to support once they were at the door, but across the project, it was only 15%. We have 85% of people that we weren't able to intervene and support them with at the point that they were talking to us. And I think that this is really interesting because when we think about the needs that humans have, if our house is on fire, if we have a medical emergency, anything like that, we know where to go and what to do for ourselves, but we don't really know what to do for our pets when we're in crisis and or in need of something. So we need to get the word out about what is available to pet owners and to integrate that into human service conversations, into our communities to reach audiences that we're maybe not reaching, so that people, when they're faced with a barrier to keeping their pet, but they want to keep their pet, that they know what to do. Okay, so now tools for getting started. And this is also Kaycey's board that she has in her lobby with some different resources she offers. Okay.
So, thinking about Amanda, thinking about being proactive, I would imagine that they take these topics here and probably push those messages out as well, right?
Yep,
Because having it here on the bulletin board isn't as proactive as
definitely,
email or,
definitely.
newsletters, speaking opportunities, social. We have 15 minutes remaining, just FYI.
So these are also the things that her staff are talking to people when they reach out, but I know that that's her next step is really getting this information out before people are having that conversation. But yeah, you're exactly right. Okay, so if you are interested in learning more about this project or some of the resources that we talked about today, whether that's the intake reasons list or how to have those conversations, those more conversational approaches to intake and some training for your staff, scan this QR code, go on our website. We have some great short training videos that you can give out to staff. There's an interactive booklet and a lot of great information out there that we are continuing to add to, and a great place to get started. I will pause for just a moment.
So I feel like this is often this question that I'm going to read is often the struggle, right? With any just taking a step back and needing more detail and having more conversation. And let's see if you guess what it is. It would be too much time, right? So
Sure.
moving from that transaction to triage. So Adrian's saying one concern they hear from staff and volunteers is that these triage types of conversations will take too long. Do we have suggestions or
Definitely.
recommendations on for how long intake triage conversations should take at the various points of contact?
Yeah, I don't have the recommended like this should take this many minutes because every circumstance is different. And that's definitely Adrian, that's a common thing that we get from shelters. We have created these processes and tools to try to reduce that so that staff isn't can kind of follow a script and get information along the way so that it's not taking an absorbent amount of time. However, it does take a little bit more time to have those conversations. Anything that we can give to to the public ahead of time is also helpful. So I know at Greenville they had it in survey form first. So when somebody first reaches out to the shelter, they fill out the survey that captures that information so that when staff is going to have those conversations, they already know where the conversation is headed, right? So they know what the main issues are. They can come prepared. And while it does take a little bit more time, we also got feedback from staff that being able to walk into that conversation, whether it be on the phone or in the intake lobby, knowing what the person is needing was actually giving them a lot more um, ownership and feeling a lot more comfortable in their role where instead of not knowing what is coming when you're walking up to the next person or have the next person in line, they felt like, okay, I can already meet this person with solutions and empathy and support because I know what's coming and I don't have to adjust in the moment. So it is a little bit of a give and take, but overall, we didn't get feedback that the time it took was a huge issue. That's a
So, a
great.
couple more questions. So Ruby is saying about 25% of their surrenders in 2024 were pets in need of assistance due to moving housing issues, including homelessness, eviction, no pet policies, etc. What resources can we offer to these people? This is our number one reason for surrender by a mile, and we always struggle to find resources that can help these owners in time.
Totally. So Heart LA creates a lot of great resources specific to this. If you go onto their website, or we can put it in the chat. They have a lot of, especially for evictions, they have an evictions toolkit that is great for this. Also doing some research in your community about where where pet-friendly housing is and what is available so that you have it on hand and what those fees are. Do you have a donor who is willing to cover one-time fees, stuff like that, like building out a plan ahead of time. But I would definitely check out the Heart LA resources for this. Their evictions toolkit is very helpful.
And Ruby, depending on your community, I realize, just after kind of doing these round tables in different communities, sometimes you're limited to what's available in the human service world. So get a much longer plan that you might need to put in place, but really starting to have discussions with the human service organizations, planting the seed of the importance of them also considering co-sheltering, what's happening within your housing landscape, and just really being seen as part of the solution and getting more involved in what's happening in the community and having discussions. And I think opening up these struggles to the human service organizations or housing, or I'm trying to think what else was on there, landlords and such, that you can start having discussions to come up with solutions together.
I'm gonna skip forward. I won't read all of these because I know we're running out of time. But just want to have these up there. Well, I'll quickly say them. So summarizing all of this work down into just 6 bullets here. We want the takeaway to be that members of our communities have valuable information that we can be using to help individual circumstances, but also inform strategic planning at a greater level. Human circumstances leading to pet surrender are complicated, as we demonstrated here today, and understanding those different pieces of the puzzle can really help us support pet owners. Use forms and software efficiently. Not everything has to be a long conversation starting at 0. There's a lot that we can do efficiency wise, and talk to your software companies about how they can help you to streamline. Conversational approaches to intake is absolutely so important when we are becoming integrated with our communities and being seen as part of the holistic solution for pet owners. Place emphasis on the owner's perspective. So intake reasons should not be just about what you need to do to move a pet through, but understanding the root cause of why a pet comes in and just being aware of our own personal bias and how that impacts how we collect information, knowing that getting information directly from the owner's perspective is the best way to go, and being proactive. Really quickly, we will also be talking about this topic and be releasing a few more findings at the Humane World for Animals Animal Care Expo coming up in April. We'll also be doing a part 2 to this webinar where we focus just on stray pets and what finders are doing when they find lost pets. And a big thank you to our participating shelters who helped us pilot this project and get some insight into what works and what can be done better. And then, of course, a thank you to our sponsors. And I don't have her email down here, but maybe Nicole can put Kaycey's email in the chat for us. And then, okay, I'm done now, Elke, if you want to ask more questions.
And some of these are some pretty, I think, tricky situations, and it also will, I think, your organization's philosophies and policies might come into play with these. But so I'm gonna get some of the easier ones out. What are the other rehoming websites other than Home to Home and Adopt a Pet? I believe is there one more?
There is. I cannot think of it off the top
Yeah.
of my head.
Okay. Well, we're going to keep track of all of these questions too, if we can't. How do we do that normally? Sorry, everybody. If we can't get to these questions, how do we respond back?
We can compile the answers to the questions and release
Uh-huh.
them out with the webinar recording.
Okay. And if Nicole, if you have any thoughts on that, please put them in. So let's see. We find behavior is a high intake reason, but mostly for pet-to-pet safety and pet-to-human safety and circumstantial dog bites. And what is done for that at intake? And again, I think that all depends on your policies. You know, if you are counseling for euthanasia, or if you are providing resources with the understanding that in taking that animal may or may not lead to adoption. Also, you know, if you have resources outside of your organization for behavior support, you know, and compiling all of that, whether it's virtual type training, local trainers, and depending on the dog bite situation, you know, those are of course a safety issue that you just need to assess what was the reason for that dog bite. So that's just something as far as like what your policies are and who you're taking in.
Also, and I'm noticing I didn't put the QR code in here, but
Mm.
if you follow that QR code to the intake triage booklet, we also have an entire section built out specifically around behavior related intake and behavior intake reasons, to help guide staff uh, through getting the appropriate information. But like Elke said, it does also come down to your organization's policies and how you go about that. But we do have, I would definitely encourage you to check out those resources. It might help with some of those questions.
And we will find out. I think in our supported self rehoming, Nicole, maybe there's more the list of the rehoming sites. I think that might be listed there. So here's a financing question. How are they financing this program? So I think that must have been maybe Greenville grants, or is there money from the shelter budget directly that's for pet fees, etc.?
I can't speak for Greenville specifically, but I do know that when we've talked to um, different organizations about this, that sometimes we hear there's all different options, right? We hear that sometimes they have donors or sponsors who are interested in funding specific things like pet fees or behavior training, or medical cases. And so they are able to have funds to point to for each of those things because they offer those like packages or options um, to their donors. And then yeah, there's also grants out there that are available. I don't know exactly what Greenville was doing in this situation. But regardless, even if it's not if you're not able to give money towards these things, you're still able to fit this into a typical intake process. We built it as streamlined as possible, so it takes up the least amount of time. But getting the information is the first place to start to really like know where that need is, so that when you go to ask for money for funding around programs, you can say, okay, this is our biggest need, because maybe it is behavior and not housing, like in the case of Greenville.
I'm not sure if this has ever been stated, but what is the appropriate amount of time to schedule out owned animals versus strays? And again, I think that has a lot to do with what our expectations around if you have contracts. There's probably a little bit more that finesse that goes into that question, but you know, I've heard there's some shelters, it's a couple weeks, it's a couple months. It probably also depends on your population management.
And go ahead and you can also email us directly. I will just scroll back over to our email address here, and we can answer some of those specific questions one-on-one.